Ladies and gentlemen, welcome to the Tennessee Healthcare Hall of Fame ceremony and luncheon. We will begin our program in 5 minutes. Please make your way to your seat at this time. Ladies and gentlemen, we will begin our program in 1 minute. Please take your seat at this time. Ladies and gentlemen, please welcome to the stage Belmont University President, Dr. Greg Jones.
Good morning and welcome to the Fisher Center for the Performing Arts here at Belmont University. We're delighted to welcome you into this wonderful space, which we inaugurated just a little over a month ago. It's my honor to welcome you to Belmont and to this Tennessee Healthcare Hall of Fame's 6th annual induction ceremony and luncheon reception. We're here to celebrate today a group of individuals who collectively have changed the healthcare landscape throughout our city, state, region, nation, and beyond. Together, and with the inductees that have come before, this group of innovative leaders have secured our state status as the nation's healthcare capital. Belmont is honored to serve as the host of today's event as we celebrate those leaders who have contributed to the success and growth of this important industry. But we can't begin our time together without acknowledging the hard work and dedication of our fellow founding partners, Belmont's McWhorter Society and the Nashville Healthcare Council. As an institution of higher learning with many programs in the healthcare sector, including pharmacy, nursing, public health, social work, physical and occupational therapy, a healthcare MBA, and a medical school that we hope will open in the summer of 2023, we're keenly aware of the impact and importance of healthcare education. We're dedicated to training our nation's next generation of healthcare leaders as our students dream of the day that they might cross this stage themselves. Though we're dedicated to spending time in the classroom ensuring our students learn the technical skills that will be required of them, we hope that our students will also embody the character, the integrity, the ingenuity, and selflessness of the individuals we recognize through the Hall of Fame. Today's event will be guided by John Siegenthaler, an award-winning communications professional. John anchored NBC Nightly News Weekend Edition for a decade. He covered presidential campaigns, political conventions, natural disasters, and currently is a senior partner for DVL Siegenthaler, a Finn Partners company in Nashville. After serving as our event's MC for 3 years, Mr. Siegenthaler has become a staple of this Hall of Fame celebration. But before John takes the stage, we'll begin our time together with a special musical blessing performed by Belmont School of Music faculty member Ryan Joseph and student Caleb Yang. This inspirational blessing is dedicated to the frontline healthcare workers who have worked tirelessly to fight the pandemic. Their dedication, sacrifice, and determination to champion the health and healing of thousands is nothing short of heroic. Please welcome our musicians to the stage.
Healthcare, among history's most noble callings, born of desire to heal the sick, improve lives, and make a difference, and realized through people with hearts that care deeply, hands that treat skillfully, minds that think radically, and feet that take them wherever the need is greatest. No group of people better exemplify the calling of healthcare like the members of the Tennessee Healthcare Hall of Fame. Individuals who made it their life's work to improve health and healthcare, not only close to home, but throughout the world. Visionaries who saw a better future and led the way there. Innovators who worked tirelessly to solve some of the world's toughest healthcare challenges. Researchers and scientists whose discoveries changed the course of medicine. Caregivers and practitioners who treated endless patients with afflictions both known and unknown. Groundbreakers who pushed through boundaries. Philanthropists, educators, public servants, advocates, humanitarians, all working through different means to the same end, to care for the health of all. Behind them comes another generation, born with the same desire to help others. Individuals whose own life's work will be greatly inspired by those who came before and showed them the way.
Hi, everyone. I'm John Siegenthaler, and it's great to be back in a facility like this and see each other and be with each other after a couple of years. This is really terrific. I know this is a smaller crowd than we're used to, but it's a strong crowd. So please, express your enthusiasm for our honorees today. It's great to see you. It's great to be back. It's great to see this incredible facility here at Belmont. And thank you, Dr. Jones, for the introduction. I appreciate it. I've been doing this for the last 3 years. I'm honored to do it again for a 4th year. I just want to say thank you to those incredible musicians, Ryan James and Caleb Yang, who just did a terrific job. We'll see many more performances in this facility, I'm sure, just like that and others. So we're honoring 10 individuals who have made a significant impact on our nation's healthcare industry, and they come from many cities across this state, countless disciplines, specialties, positions, passions, skills, and a dedicated commitment to philanthropy. These healthcare innovators have paved the way for Tennessee's ever-growing position as a major player in the national healthcare discussion. And they join the Hall of Fame's 34 previously inducted members. First, let me recognize and thank those who made a difference, who really helped make this celebration and induction ceremony possible. 13 well-respected and accomplished healthcare professionals from across the state served as the selection committee members to choose this year's inductees. They include Ms. Sharon Atkins, Mr. Craig Becker, Dr. Wilsie Bishop, Dr. Reginald Coopwood, Dr. William Evans, Dr. Robert C. Fisher, Dr. Henry Foster, Mr. Robert A. Frist Jr., Mr. William Gracie, Ms. Vicki B. Gregg, Dr. Lynn Massingale, Dr. Jonathan Perlin, and Mr. Stephen Reynolds. We are so grateful for your service and dedication to this initiative. Please give them a round of applause. Please stand. Next, we'd like to recognize our sponsors today whose participation made this celebration possible. The generosity of our grand sponsors, HCA Healthcare and Community Health Systems, enables us to celebrate these inductees and contributes to endowed scholarships at Belmont, which support the education of future healthcare professionals. We'd also like to recognize our presenting sponsors, including Earl Swenson and Associates, Royal Industries, FTI Consulting, LifePoint Health, Lovell Communications, and Memphis Hospital Group. And I also would like to turn your attention to our patron sponsors denoted in today's program. Take a look. This Hall of Fame is incredibly grateful for all of our event sponsors and those who made this celebration possible. Please give them a round of applause. All right, so we have a couple of years to cover here. And we're going to get started. As we begin our 2020 inductions, I'm pleased to recognize Monroe Dunaway Anderson. Born in Jackson, Tennessee, Monroe Dunaway, M.D. Anderson, lived a life guided by basic principles: hard work, thrift, and personal charity for those in need. He began his career at People's Savings Bank and later became treasurer, president, and chief financial officer for Anderson, Clayton and Company, which became the largest cotton trading company in the world. Upon Anderson's death in 1939, his fortune passed to his charitable trust, and this trust was ultimately used to fund the Texas Medical Center and the M.D. Anderson Cancer Center, the #1 cancer center in the world. His generosity also assisted in establishing libraries, auditoriums, college buildings, and a university planetarium in his hometown of Jackson, Tennessee. Anderson's vision and desire to dedicate his fortune to those less fortunate endures today through his trust. Please welcome the CEO and president of presenting sponsor Lovell Communications, Rosemary Plorin, to the stage to present Tammy Buchanan with an award. Ms. Buchanan is representing the M.D. Anderson Nomination Committee.
Good morning. Have we said good morning to each other yet? I don't think so, but it is well with our souls. It's a joy to gather today at Belmont University. We have been anticipating this day for 2 years, and so I thank Kate Mosley for all of her diligence and communication to all of us. I especially want to thank our nominating committee, the work of Rick Kendall, and Barbara Day and Richard Day, who still today are being served and cared for through the M.D. Anderson Cancer Center. They've been diligent, and we've been patient and done this with care and with a lot of love. As we collected and prepared information, we recognized the influence of one person from Jackson, Tennessee. He was a difference maker. One person can be a difference maker. Monroe Dunaway, M.D. Anderson, was that kind of man. The M.D., as we sit here among many physicians, it never reflected a schooled physician. Yet his name has become synonymous with superior research and cancer treatment. In the recently released U.S. News and World Report, M.D. Anderson Hospital again ranks #1 in the world, in the whole wide world. Almost 82 years later, after his life, after his death, we glimpse his future. We here present, we experience the legacy of his life. In 80 years, as we all sit here together today, who knows the significance of any of our names? What will any of our names hold? We don't know. But at present, I am indeed inspired to be more intentional as I consider how my actions may thoughtfully assist and improve the lives of many others. On behalf of the scientists, the librarians, the researchers, the professors, students, caregivers, and most especially the patients, I thank the Belmont University Tennessee Healthcare Hall of Fame board and members and the selection committee for this distinguished honor posthumously bestowed upon M.D. Anderson, alongside these very, very deserving inductees. Thank you.
Thank you, Tammy. Our next inductee is well known throughout this state, Governor Phil Bredesen. Phil Bredesen served as mayor of Nashville from 1991 to 1999, and as governor of the state of Tennessee from 2003 to 2011. As governor, Bredesen revitalized TennCare, which today remains a nationally respected model of state Medicaid. He led significant public health and enforcement efforts to address the state's methamphetamine crisis. He initiated successful public health efforts to reduce teenage smoking and infant mortality, and he instituted state programs to provide health insurance for uninsured adults and children and to assist with prescription drug costs. Bredesen has been instrumental in developing Tennessee's presence in the private sector healthcare as well. He found and ran Health America, an NYSE-listed HMO company with 6,000 employees, and he later founded Coventry Corporation, now part of Aetna. He's been active in his community outside of government service as well, founding Nashville's Table, a nonprofit organization collecting unused food from local restaurants, hotels, and grocery stores, and the Land Trust for Tennessee, which has preserved 130,000 acres of sensitive land in our state. Governor Bredesen has led a life of public service and unwavering dedication to the well-being of his Tennesseans. Please welcome Chad Campbell, the Regional President of Grand Sponsor Community Health Systems, to present Governor Bredesen with his award.
Thank you very much. I am honored to be here in this wonderful space. And Bob, I don't know why you couldn't have made something a little bigger and more well-appointed than this, but it really is an honor for me to be, first of all, included in the Hall of Fame, but especially to be in the company that I am today. It's a sobering experience. I really appreciate and like the way in which the Hall of Fame has a mix of people that is honored. People on one hand who have been the providers of medical care, the researchers who've done the science, the people who've actually done the hands-on work, and of course Belmont is training a whole new generation of them, but also some of the people who organize it and put it together and make it work. As I've learned during my time in this field, the frontiers in healthcare today, they're moving away from being the scientific and the technological frontiers, and I think more into the soft side of things. We have this wonderful science. How do we get it into the hands of people? How do we let people access it? How do we take this complicated system and make it into a more holistic one for the benefit of patients? You know, things like problems we have in this country with infant mortality. It's not the science. We're the best in the world by far on the science and technology. It's issues of access and doing a good job of bringing to bear all that knowledge and expertise that we have. So I just wanted to say, as I say, thank you. I hope that the Hall of Fame will continue to honor both sides of this equation, not only the wonderful people, especially in these past couple of years, who actually provide the care, who provide the science behind it, but also those who work to connect all that science with the need of America's citizens. Thank you.
Congratulations, Governor. Our next inductee is Dr. Katherine M. Edwards. Dr. Edwards is a renowned researcher. In 1980, when she came to Vanderbilt University Medical Center, Dr. Edwards became one of 2 pediatric infectious disease researchers at Vanderbilt. Currently, Dr. Edwards serves as the Sarah H. Sell and Cornelius Vanderbilt Endowed Chair in Pediatrics, Scientific Director of Vanderbilt's Vaccine Research Program, and Professor of Pediatrics at Vanderbilt University School of Medicine. Throughout her internationally recognized and decorated career, Dr. Edwards has contributed to vaccine development and the elimination of countless diseases. Her work has informed evidence-based treatment protocols for numerous infections, and she has led trials for nearly every infectious disease for which effective vaccines exist. Her contributions to preventing pediatric pathogens, documented in her 500+ scientific publications, have advanced public and child health immeasurably. Dr. Edwards' work has advanced vaccine science, saved countless lives around the globe, and trained the next generation of pediatricians, infectious disease doctors, and researchers. Please join me in welcoming Charles Overstreet, leader of presenting sponsor FTI Consulting, to present Dr. Edwards with her award.
Good day, fellow awardees and guests and Belmont leaders. I want to thank Belmont University for hosting the Tennessee Healthcare Hall of Fame induction ceremony and for selecting me for membership in this esteemed group. To join the ranks of previous award winners is a great honor. It's also humbling to see those who have gone before. 40 years ago, I came to Tennessee to assume my first job at Vanderbilt University after completing my training in pediatric infectious diseases in Chicago. One of the main reasons I came to Tennessee was the work of Dr. Sarah Sell, who had been studying new vaccines for the prevention of meningitis, an infection around the brain. The last night, as I was a pediatric resident in Chicago nearly 50 years ago, I tried futilely to save the life of a young child with meningitis. I was not successful. This experience was pivotal to my decision to come to Vanderbilt and to pursue a life of prevention of infectious diseases. When I came here to Vanderbilt at any one time in Children's Hospital, there were 3 or 4 children suffering from meningitis. Soon after arriving, building on the work that Dr. Sell began, we worked with pediatricians in the community and parents who allowed us to work and study the vaccine in their children. The vaccine proved to be highly effective and very safe. And now bacterial meningitis is virtually gone, not only in Tennessee, in the United States, but in the world. We now never have cases of this in Children's Hospital. For the next 4 decades, I was welcomed into the community by the pediatricians, by the health department in the city, and by the state health leaders to study vaccines for many other serious diseases. We have made an impact on death and serious illness by vaccine. We were well poised to attack the COVID outbreak when it began. Many of the scientists that have served pivotal roles in this vaccine endeavor received their training in Nashville and at Vanderbilt and other institutions. The power of vaccines has been made very clear to me. Vanderbilt has provided a collaborative environment where discovery flourishes. The number of individuals trained with us have been amazing, and they have taught me more than I have taught them. I am indebted to the community of Nashville, to the state of Tennessee, and to the pediatric providers and parents where my work has been conducted. Finally, I want to thank my 4 children, their spouses, and my 8 grandchildren who have taught me how to be a better parent and have filled my life with joy. In fact, my youngest daughter will be going to MD Anderson to complete her training in oncologic surgery. So I was very proud of hearing about MD Anderson. And my husband of 50 years, who has been a source of enormous support and love. Thank you so much. I appreciate this honor greatly.
Congratulations, Dr. Edwards. Our next honoree is Dr. G. Scott Morris, a leader, you forget about these things sometimes, a leader in community health outreach. Dr. G. Scott Morris founded Church Health of Memphis in 1987, where he served as CEO to this day. Established as a faith-based health clinic for working uninsured, Church Health now cares for over 70,000 people who depend on its services. Under Dr. Morris's guidance, Church Health developed a model for distinctive patient care that went beyond medicine to encompass movement, emotion, nutrition, friends and family, and spiritual life in caring for the whole person. His vision, endurance, and exceptional capacity to engage others has made Church Health the largest faith-based, privately funded health clinic in the country. Their replication workshops and consultation services have helped more than 50 free and charitable clinics get their start. Dr. Morris has spoken, written, and shared his expertise and experience widely, making his impact on community health outreach extend across the country and around the world to countless individuals in need. Please join me in welcoming David Minigan, design principal at presenting sponsor Earl Swinson and Associates, to the stage to present Dr. G. Scott Morris with his award.
So it's a true honor to be here. I speak on behalf of all of those who work at Church Health and our thousands of volunteers who make our work possible. So across the state of Tennessee and in Memphis, my hometown, there are hundreds of thousands of people working in low-wage jobs who do not have access to quality health care. Now, these are the people who work to make our lives comfortable. They cook our food, they take care of our children, they wash our dishes, they cut our grass, they'll one day dig our graves. They don't complain, yet when they get sick, their options are very few. So in Memphis, for the last 34 years, Church Health has been committed to provide quality health care, to provide the same care you would expect your mother to receive. We're able to do it with the help of over 1,000 physicians who volunteer with us, with the help of the healthcare system across Memphis, the hospitals, organizations like Smith & Nephew that will provide implants if somebody needs their knee replaced. It's often referred to as Church Health magic, but it's really a reflection of the fact that our community has come together to take care of our neighbors. So we began in 1987 in a small house in Midtown that was once a brothel. But even that business wasn't very successful there, and so we moved in. And then 5 years ago, we became the anchor tenant of a redeveloped Sears distribution center, now known as Crosstown Concourse. It is larger in square footage than the Empire State Building. It is a reflection, I believe, of the work that we do. We are a true faith-based organization. We're not a federally funded anything. We are focused on finding ways for the faith community to do what we believe God has called us to do. You know, we're not here to solve the great social problems in America. We actually don't know how to do that. We're not even trying to do that. But what we do believe we have been successful at is finding a way to bring people of faith together and build an organization that shows what's possible in God's imagination. Thank you.
Don't want to break it. So now we turn to Donald S. McNorton. A prodigious businessman, Don McNorton has led companies and boards throughout Tennessee and across the country with compassion and success. After working with Prudential Insurance Company of America in various capacities, McNorton went on to work as CEO and chairman of HCA Healthcare. While McNorton was CEO and chairman, HCA grew from a regional phenomenon to a national company, both feared and emulated by its competitors. McNorton's leadership of HCA and its spin-off Health Trust consistently created a culture of honesty, camaraderie, and respect. His ethical conduct inspired others to set a high standard for the future of corporate healthcare leadership. On behalf of the McNorton family, who could not be with us today, I'm accepting this award. His sons, Don and Dave McNorton, have provided the following remarks, and I'll read them for you. Donald McNorton, our dad, who was born in 1917 in upstate New York. Addicted to hard work and with a drive to succeed, he went to college on a basketball scholarship. After World War II service in the Pacific, he obtained his law degree on a GI Bill and practiced as a small-town attorney, but soon looked for bigger fish to fry. We moved to New Jersey, and our dad joined the large legal department of Prudential Insurance. After an unprecedented meteoric rise through the corporate ranks, he became CEO and chairman for 15 years. During his long tenure as head of Prudential, it became the largest life insurance company in the United States. Our dad held directorships with IBM, AT&T, Exxon, J&J, and the New York Stock Exchange. After turning past 60, our dad chose to come to Nashville to work with the Frist family, where he stayed for nearly 20 years. He loved these years of his life and all the new friends that he met, including Clayton McWhorter. Tennessee welcomed us with open arms, and his years at HCA and Health Trust capped a wonderful business career. Our dad passed away in 2002. We are grateful to Belmont University for this award, and we are sorry we cannot be with you. Congratulations to the McNorton family. Okay, that concludes our inductions for the 2020 class of Hall of Fame, but we're not done yet. Next, I'd like to welcome our Hall of Fame founding partner representative, Senior Vice President for Membership of the Nashville Healthcare Council, David Grider, Belmont University Provost Thomas Burns, and Belmont McWhorter Society Representative Mary Overstreet. Give them a welcome.
Good afternoon. The Nashville Healthcare Council exists to inspire global collaboration to improve healthcare, and this is through thought leadership and innovation. Our member companies, they know and understand our collective responsibility to better healthcare for everyone, and it's this mentality and action that has made Tennessee this nation's healthcare capital. And we're grateful for the opportunity to look forward as we dream of what the industry will become. Yet, we can't look forward without acknowledging those who have established the very foundation we stand on. So the Council is honored to serve as a founding partner of the Tennessee Healthcare Hall of Fame and celebrate these iconic legends. Thank you all.
At Belmont University, we care deeply about the future of healthcare. In addition to our programs in nursing, physical therapy, occupational therapy, social work, exercise science, pharmacy, public health, healthcare business, and healthcare law, Belmont will soon be opening a new College of Medicine. Our curriculum is thoughtfully and strategically designed with an eye toward where healthcare is headed, understanding the industry's needs for young talent who are prepared to contribute to both its future and present states. Our hope is that each year we will graduate a class of future Tennessee Healthcare Hall of Famers who will one day engage and transform the world in meaningful ways.
But many of our future Hall of Famers don't have the means to pursue the education required to follow their hearts and minds. into the healthcare field. That's why the late Dr. Richard Treadway and Dr. Bob Fisher founded the McWhorter Society to provide financial support in the form of scholarships to future healthcare leaders. Named in honor of the late Clayton McWhorter, a healthcare giant and 2015 Hall of Fame inductee with a heart of gold, the McWhorter Society has provided scholarship assistance for more than 160 students since its inception. It is our hope that these students are deeply inspired by each year's inductees and are motivated to leave their own mark on the healthcare industry. On behalf of all three founding partners of the Tennessee Healthcare Hall of Fame, thank you for being here today.
Thank you, guys. Now to 2021. And our first inductee of the 2021 class is Dr. James Hildreth. From 1989 to 2005, Dr. Hildreth served in several positions at Johns Hopkins University School of Medicine and was the first African American in the 125-year history of Johns Hopkins University School of Medicine to obtain full professorship with tenure in the basic sciences. Dr. Hildreth established the Center for AIDS Health Disparities Research Center at Meharry Medical College and went on to become president and CEO of Meharry. Thanks to his background in virulent diseases and care for the underserved, Dr. Hildreth was asked to join Mayor John Cooper's COVID-19 task force in 2020 and President Biden's Health Equity Task Force in 2021. Dr. Hildreth has become a leading voice on efforts to alleviate minority health disparities and improve access to quality care. He has catapulted Meharry to the national stage as a prominent expert on COVID-19, the pandemic's impact on minority communities, and systemic oppression. He's established Meharry and its graduates as leaders in the fight for health equity. It's my pleasure to welcome grand sponsor HCA Healthcare's President of Clinical Services and Chief Medical Officer, Dr. Jonathan Perlin, to present Dr. Hildreth with his award.
Good morning. I want to thank Belmont University and Tennessee Healthcare Hall of Fame for this singular honor. I also want to take this opportunity to thank my fellow Arkansan, President Fisher, for his great work and leadership over the years and his kindness to me. Thank you, Bob. So I'm really humbled when I think about past inductees and the present inductees in this Hall of Fame to be honored in this way. But I also want to thank my friend and colleague, Dr. John Perlin, for his long support of Meharry as a member of our Board of Trustees, and in particular, his support of me as president for the last 6 years. So in 1982, when I came back to Johns Hopkins from doing my graduate studies at Oxford, having done a PhD in immunology, my intent was to become a transplant surgeon. But the first patient I took care of as a medical student was a young African-American woman in her early 20s who had HIV. She and her baby both had HIV, and they both died. There was nothing we could do for them. And that had a huge impact on me, so I changed my plans and became an HIV specialist researcher. And I've spent 34 years of my life studying this pathogenic virus, and who would have thought that it would be such great preparation for a once-in-a-century pandemic of COVID-19, but it has proven to be that. In my journey of 46 years since leaving Camden, Arkansas, I've been fortunate and blessed to interact with some amazing people, a long list of students, mentors, fellows, collaborators, and colleagues. Each one of them has helped to shape my path, sharpen my focus, inspire my work, and contribute to my success in some way or another. And I'm grateful to each and every one of them. This recognition is also in part for the extraordinary institution I have the honor of leading, Meharry Medical College, which for 145 years has been a beacon of hope and opportunity for generations of healthcare providers and patients in need of care. Meharry's legacy and mission has been on full display for the last 18 months as our students, faculty, and staff stepped into the breach in the fight against COVID-19. I could not be more proud to be Meharry's chief cheerleader and to play my part in writing this chapter in Meharry's history. And helping me write that chapter are members of my Wisdom Circle, Meharry's senior leadership team, some of whom are with me here today. And to each one of them, I offer my appreciation for their commitment to Meharry's mission and being exemplars of servant leadership. Finally, I want to thank my two children, Sophia and James, for their patience and love and support, especially in my salad days when I was green and tender, trying to establish myself in the world of biomedical research. But the greatest thanks I owe is to my life mate, foil and best friend of 43 years, my wife of 42 years, Phyllis Drennan King, who's been a steadfast and patient supporter of me, while all the while working tirelessly in various roles and organizations in the fight for social justice. And again, thanks to Belmont University and the Tennessee Healthcare Hall of Fame, and thanks to all of you for being here today. Thank you.
Congratulations, Dr. Hildreth. Our seventh inductee is Tom Ciguran. Tom Ciguran has a long and impressive career in the healthcare industry. In 1981, he co-founded American Health Corp, which over the years owned and operated general hospitals, psychiatric hospitals, koala centers, addiction treatment centers, and diabetes treatment centers, and eventually, after a name change to Healthways, Inc., became the largest chronic disease management company in the United States. In 1992, Healthways co-founded AmSurg Corp., a nationwide provider of outpatient ambulatory surgery, which grew to over 275 centers. In 2014, AmSurg acquired Sheridan Healthcare, and in 2016 merged with Envision Healthcare Corp. to form one of the largest healthcare companies in the United States with over 48,000 employees. He's been active for over 20 years in working to improve Nashville public schools as well and to educate the future leaders of Haiti. He served on the boards of Vanderbilt Medical Center, Alive Hospice, Vanderbilt Owens School, Harpeth Hall School, and other nonprofits. He is a co-owner and served as chairman of the ownership group of the Nashville Predators from 2010 to 2018. Please welcome Regional President of Grand Sponsor Community Health Systems, Chad Campbell, to present Mr. Ciguran with this award.
Well, good morning, and first I'd like to thank the Belmont University, Bob Fisher, who's been a friend for many years, the Tennessee Hall of Fame, and the Nashville Healthcare Council, all of which have been important to me in my past career. I've always tried, no matter what I did in healthcare and in other fields as well, to approach it doing three things. One is set out to do something important, something that makes the world a better place. Those of us in healthcare, that's pretty easy. And all of us, in one way or another, have helped to make the world a better place. The second thing is find the very, very best people who commit to that kind of a goal and to be the very best at that goal. And the third thing is to build a culture, a work environment and an ethical environment where these people can do their very best work. I think of all the people I have to thank, and there are so many, I'll start with the people who I worked with in this environment for 35 or 40 years, depending on how you count. Whatever success I had, they're responsible for it. I was the cheerleader and the orchestra leader maybe, but they were the creative force that enabled us to do the things that we did. So a special thanks to all of those who I worked with in our companies and throughout the Nashville healthcare community. Everyone helped us along the way. I also want to thank my family for their loving support, which was constant for the last 40 years. And finally, I want to thank the people of Nashville who collectively and individually accepted my family, our family, into this community in a way that has made it a home that we are proud to be members of. So thank you for this honor, which as I thought about it, I'm not sure I deserve, but thank you.
Congratulations, Tom. Our next inductee is Autry O.V. Pete Deusk. In 1973, Deusk founded DeRoyal Industries, a manufacturer and distributor of hospital and outpatient medical products and devices. Today, DeRoyal's workforce is 1,900 employees, operates 21 facilities, locations in 6 countries with manufacturing assets on 3 continents. Deusk has built a worldwide team that brings value to customers in distinct markets, including surgical devices, unitized delivery systems, orthopedic supports, and bracing and wound care dressings. As chairman of the Board of Trustees at his alma mater, Lincoln Memorial University, Deusk has been a driving force in its evolution from a small, well-respected, but little-known school to a thriving institution dedicated to serving its Appalachian community. Deusk served on the Medicare Payment Advisory Commission from 2000 to 2006, working to advise Congress on a myriad of issues related to Medicare services and reimbursements. Deusk has made meaningful contributions to many people throughout his philanthropic initiatives, foremost of which was the founding of the Deusk Family Boys and Girls Club, a vibrant organization serving youth in the communities near DeRoyal. Please join me in welcoming Brian Deusk, President and CEO of presenting sponsor DeRoyal Industries, to the stage to present his father, Mr. Deusk, with the award.
I would like to start out with certainly getting my priorities right that my wife reminds me of. I'm most thankful to my wife, Cindy, and the many kids back there on that road for tolerating me, because I'm a charged type person. I've been known to get out and just work and work and work, and I'm at a ripe old age. I haven't changed a bit, so I go way back. I go back to the early days in the 60s. I'll talk to you a little bit about that. But first, I would like to thank Belmont University, the McWhorter Society, Nashville Healthcare Council, as well as the selection committee and those who wrote letters of support. It's with great honor I accept this coveted award today. It doesn't take long to figure out there has been other fine people that have received this award. I have the utmost respect for Clayton McWhorter, an old friend, Tommy and Bill Frist, Dr. Lynn Massengale for sure, and just to name a few. I've watched this healthcare industry evolve since the early 1960s and have seen Nashville become the mega center for healthcare that I take a great deal of pride in. And you've got to start with HC there. Boy, they've really led the way. I believe the growth in Nashville has us positioned as a global hub for healthcare. Now, I want to go back and dig down just a little bit. I came along in the 60s. What happened in the 60s? The first disposable syringe came out. We were beginning to figure out that sometimes if you wanted to die, just go to the hospital. And we realized about the infections, what was going on. And of course, along about that time, thalidomide, a lot of you will remember thalidomide, Senator Kefauver. The first warning it came out, it was driven by a senator from the great state of Tennessee and health care. They actually called the card that he required every doctor to receive when you made a presentation was the Kefauver Memorial Card. When you presented, a sales rep presented it to a doctor. So Tennessee's got a lot of history here. But where I came along, of course, in the 60s, gosh, it was a lot of fun. Things were exploding, HCA was exploding, and I was out finding new product. I would go and visit people who had new ideas. They never had a marketing plan. They could not put it together, but they had the idea, et cetera, et cetera. So many a little company I helped get started by writing their marketing program, helping them put the product together and getting it on the marketplace. You have no idea how many things I've been involved in. So I had a great time doing that all those years, and I'll always be thankful for that. The Royal Industries has been very blessed with some of the patents, and products through our developing and acquisitions. My real education in healthcare began, my advanced education, as a result of my appointment to the Medicare Payment Advisory Commission in 2000 and served there for 2 terms. I had access to learn to appreciate the vital industrial role of organizations such as the Joint Commission, CMS, Health and Human Services, Food and Drug Administration, and the OIG, Office of the Inspector General. I was exposed to all those things, so you can imagine for a young man out of East Tennessee, out of that area, and what an experience that was. I've also been given the opportunity to travel abroad and study the different healthcare systems and how they work. This gave me a good look at socialized medicine. Ultimately, I'm so thankful for the system we have here today. I really learned an appreciation for our healthcare system after seeing what all was involved in that. And again, thank you. The industry, as you can see, has really been good to me personally and to Royal. And I'm thankful we are one of the last family-owned businesses that choose to continue our presence in Tennessee and across the world. It has been a great experience for me and my family. Thank you.
Next, we will induct Dr. William E. Evans. Trained as a pharmacist, Evans has devoted his entire career to improving medical outcomes for children at St. Jude's Children's Research Hospital in Memphis, Tennessee, via his research, mentorship, and leadership. During his decade as CEO, St. Jude received an exceptional ranking as an NCI Comprehensive Cancer Center. St. Jude was ranked as the #1 children's cancer hospital by the U.S. News and World Report and had a consistent presence on Fortune magazine's list of annual 100 best companies to work for. Evans has authored over 450 scientific publications, and his 40-year research on pharmacodynamics and pharmacogenomics of anti-cancer agents in children with acute lymphoblastic leukemia, earned Dr. Evans 3 consecutive NIH Merit Awards from the National Cancer Institute. Of note, Evans was part of the St. Jude team that pushed cure rates from acute lymphoblastic leukemia, the most common cancer in children, from 50% in 1975 to over 90% in 2021. His corporate leadership and scientific exploration transformed outcomes of countless children and their families. Please welcome Robert Clark of presenting sponsor Memphis Hospital Group, who will present Dr. Evans with his award.
Thank you very much. It's indeed a great honor for me to be elected into the Tennessee Healthcare Hall of Fame. President Fisher, thanks for the wonderful work you've done in bringing this to fruition and the leadership you've provided. Having been born in Clarksville, Tennessee, just a few miles northwest of here, and having spent my entire career at St. Jude Children's Research Hospital in Memphis, it's indeed a great honor and pleasure for me to be elected into the Hall of Fame, along with so many distinguished members of the Hall of Fame. There are several people I want to briefly recognize this morning. Most importantly is my collaborator in every aspect of my personal and professional life, my spouse, Mary Relling, who Governor Bredesen is an implementation scientist who has dedicated her career to helping teach the world how to implement pharmacogenomics as part of healthcare in this whole move of precision medicine. I also want to thank my daughters, Leslie and Kelly, and their spouses, James and Jeremy, and my 3 grandchildren, Will, Hayden, and Savannah, for being here this morning. You make this your presence, indeed, an even more special occasion for me. And I want to thank my friends and colleagues who were able to join us this morning as well. Finally, I want to close by thanking 2 people who have made my career possible. Those are Danny Thomas, the founder of St. Jude Children's Research Hospital, and Don Pinkel, the first director and CEO of St. Jude. These 2 shared a philosophy of collaboration and inclusion. They wanted and knew that we needed to work together if we were going to solve the complex problems of childhood cancer. And they wanted everyone to have a voice. Anyone with a good question or a good idea was encouraged to speak up. Yes, they expected us to do our homework, but they wanted to hear from a student like me when I joined the organization in 1972, just as they wanted to hear from the chief of surgery. That culture that they established at St. Jude endures today, a culture of collaboration and innovation. That is what made possible changing the cure rate of childhood leukemia, which was 10% when St. Jude opened in 1962, to 94% today. And it's how we are going to continue to solve complex problems in healthcare going forward. So there are many of you in the room today who are leaders in your organization who have done just that, who have created a culture that supports your people and then encourages those across your organization to contribute to your mission. I would applaud you for doing that and encourage you to redouble your efforts if possible, because that is how we cured childhood leukemia, and that will ensure that great things continue to happen in healthcare in the state of Tennessee. Thank you very much.
And our final inductee of the 2021 Tennessee Healthcare Hall of Fame class is the late Dr. Robert Sanders. Throughout his notable career, Dr. Sanders was a tireless champion for the health and well-being of Tennesseans, especially children. Dr. Sanders was an active member of the Tennessee chapter of the American Academy of Pediatrics, where he eventually served as chairman of the Accident Prevention Committee. In 1977, his work directly led to the passage of the Child Passenger Protection Act, a Tennessee law that requires parents to properly secure children under the age of 4 in federally approved car seats, the first law of its kind in the nation and the world. By 1985, all 50 states in the United States had approved and passed related laws. This accomplishment led to Dr. Sanders becoming proudly known as Dr. Seatbelt. As former director of the Rutherford County Health Department, Dr. Sanders was also involved in several educational programs, including a program to teach sex education to teenagers, also curb teenage smoking, and advocacy for gun control. Please welcome Jennifer Peters, the Executive Vice President and General Counsel of presenting sponsor LifePoint Health, to present Ms. Pat Sanders, Dr. Sanders' widow, with his award.
Looked up this magnificent building. Only saw the inside. It's like a big opera house. It's fantastic, and thank you, Belmont, for that. But I want to thank Belmont for this Hall of Fame honor for my husband and Kate Mosley and her wonderful team. My husband would be thrilled to be here, and I mean, to know of this honor. And I want to thank my family and my friends for coming, and the two people from the Rutherford County Health Department, the director and Dr. McDonald. Really appreciate that. I wanted to talk to you about vaccine in a way, because in 1955, Bob was, he told me this, was interning in pediatrics at Vanderbilt, and Dr. Batson handed him a syringe and said, "How'd you like to give the first polio shot in Tennessee?" It was some sort of pilot program in 1955. And he did it. It made a big impact, that Salk vaccine, I think, in his mind about prevention, because he had different fellowships in neonatology and virology and 3 years of pediatric practice, solo practice in Murfreesboro. And he finally landed in public health, state of Tennessee, but at the Rutherford County Health Department and some other surrounding counties. And I think that was a perfect landing. So in 1975, go 20 years after this Salk vaccine, he picked up the Pediatrics Journal, and it was an article in August of 1975 about children as passengers. He thought it was a stunning article. Children as passengers in automobiles, the neglected minority on our nation's highways, and found out it was the #1 killer of children after age 1, the car crash. So he consulted 2 pediatricians who lived in Murfreesboro and were working in the clinic, and they thought it was good. They wanted to see if it was possible to get a sponsor for the law. And I wanted to tell John Sigenthaler Jr. that his father was consulted, and he liked it, and he said, "Come see me." And he endorsed it. The Nashville Tennessean endorsed it, but the Nashville Banner did not endorse it. I'm sorry to say. The Public Health Committee, Dr. Fowinkle was the Commissioner of Public Health, and told Bob that out of the 5 on the committee, 3 said no and 2 said yes, so he gave a big green light. You do what you can to get support for this and see if the law will pass. Well, having 2 wonderful sponsors like John Bragg and Senator Douglas Henry made a big, big difference because they had a lot of clout. And they were child advocates big time. And they did sponsor it, and Winkle was very cooperating, and it didn't pass in 1976. And Bob thought it was like a vaccine to have a car seat, you know, not 100%, but it's a big help. But the grassroots lobbying was the answer, and that, thanks to many people who helped with that, calling on weekends to different legislators. That's when I found out what grassroots lobbying was. And it passed in 1977, and it was called the Child Passenger Protection Act of 1977, and it really needed to be improved upon, and it was. I'm sad to say the #1 killer of children from ages 1 to 13 is still the car crash because of misuse of car seats or non-use. So buckle up, everybody. Thank you.
I don't want to burst your bubble, Pat, but I don't think the Tennessean and the band are agreed on much of anything. So I just want to say a couple of things. I've done this for the last 4 years now, and I just want to give a big round of applause to the staff and the students of Belmont University who do an amazing job. And this was a very, very tough year. So could you give them a round of applause for all their hard work? I do a fair number of events, and these are run perfectly and on time, so congratulations to all of you. The Tennessee Healthcare Hall of Fame serves to recognize the healthcare leaders in this state while raising money to support healthcare education. And the success of the Hall of Fame event, coupled with the McWhorter Society fundraising efforts, has raised a total of $3.7 million for healthcare scholarships. Behind me, you can see a few of the faces of those people, those hundreds of students who have benefited from these scholarships. So thank you to all of you who have contributed to this incredible, great cause. Before we go, I'd just like to thank our sponsors and thank our incredible inductees for being here today. Today's celebration comes to a close, but we're already looking for next year, and we'd like you to invite you to come and to join us as we think about next year. Nominations for the 2022 Tennessee Healthcare Hall of Fame class are open, and you're welcome to find out more information at tnhealthcarehall.com. We're glad you came. Have a great day, and congratulations to all the winners. We'll see you next year.